Good morning, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today we're going to talk about the use of GLP-1 drugs on the stabilization of mast cells. So the GLP-1 drugs include Ozempic and Tirzepatide, and they are typically used in patients who either have diabetes or have issues with insulin and they're overweight. So their intention is to lose weight. It turns out that one of the side products of GLP-1 drugs is that they bind to receptors that are on the mast cells of the body. What are mast cells? Mast cells are particular immune cells that have granules in them that contain histamine. So a person gets triggered by pollen, and that causes the mast cells to degranulate and release histamine into the system. And that histamine begins to set up an inflammatory cascade. And that's how your body is designed to handle allergies, whether it's food allergies, chemical allergies, mold allergies, all these things are handled in that way. And MCAS is, in general, a fairly difficult syndrome to get under control. It requires quite the art and talent at manipulating medications. And I feel that we're on the verge of a very, very big breakthrough by the finding that GLP-1 drugs very much stabilize the mast cell. I mean, my patients are they're not complaining about joint pain, they're not complaining about gut nausea, and I think it was pretty much due to the mast cells. So I'm really trying to, and I don't really love the GLP-1 drugs. I don't love them. I mean, I think they're okay, but if they're gonna, quiet the mast cell response for my patient population, then I think that we probably should use it. And for those of you that are interested in having a naturopath manage your GLP-1 medication, Dr. Holly Gower here in Paulsbo is very skilled, and her phone number is 360-710-7854. And so she would be able to help you figure out which medication would be best for you, how to use it, what dose, how frequent. And she's a good colleague of mine. I've known her for 30 years. So GLP-1 drugs definitely help with MCAS. So that's the takeaway message. And I hope you found this information useful, and I hope you have a wonderful day. Take care.